everyone, my name is Kyleigh. I am a PA at the Bankston Center.
And my name is Marissa. I'm a nurse here at the Bankston Center.
We are super excited to have you guys join our wellness webinar tonight. You guys are able to submit questions through the questions tab along the journey, and please stick around for the live Q&A at the end. So at the new year, a lot of people kind of start their weight loss goals and they think about diet and nutrition. They seem to do very well in the first few weeks, and then it kind of fizzles out as the time comes on and people get very busy with their schedules. So what we offer is medically assisted weight loss programs. So you really have the added benefit of having both Marissa and I consistently checking in on you, whether that's for weekly visits, monthly visits, or just by phone or by email. We really like to follow up and make sure that your program is going well for you.
And I think too, when it comes to diet and nutrition, it's really difficult to know where to start. There's so many diets on the market. Mm-hmm. You don't know, is keto good for you? Is paleo good for you? So it's really good to have that foundation, and then we get to assist you with the medical managed weight loss, and then you have those good foundations for after you're off of the medication.
Nutrition plays an extremely important role in our wellness program. We really like to prioritize high protein meals. Doesn't mean that you have to eat only chicken and meat for every single meal, but just making sure that you're making healthy decisions when it comes to your meal planning, as well as including fruits and vegetables. We do offer some products here. We do have our Celebrate protein waters that have 20 grams of protein. We have our protein minis that have 15 grams. These are both not sludgy and they do taste really well. And then we also have our protein bars that have 15 grams of protein.
Yeah. Really great, really easy way to get that protein in. And we also have some really great meal planning websites and apps that we can refer you to, as well as some really great personal trainers by request if you're interested in that. One thing that we consistently hear from patients during their consultation is, I feel like I'm cheating, or I feel like this is an easy way out, and it's really not. And we try to focus a lot on that. You are still making the decision to eat healthy foods. You are the one who's still choosing to exercise. The medication is not doing that for you. The medication isn't picking what you're going to eat for the following week. So you are still doing the hard work. We're just helping you along the way.
We also kind of hear that people have concerns about gaining the weight back after coming off of the medication. Obviously, we can expect some of the weight to return, but if we really build a strong foundation to begin with, focusing on diet and exercise and creating a good lasting plan, then you should be okay kind of coming off the medication. And we're not going to stop our support once the medication stops. We are there for you along the way.
Yeah. Another myth that we hear is, do I have to cut out all of my favorite foods? I have a birthday party next week or a wedding coming up. Like, can I still eat the cake? And, we want you to make healthy choices and have healthy fats, healthy proteins, but we still want you to enjoy the food that you like. Maybe instead of having 3 Snickers bars, you have just half of one, or start with one and work your way down. We want you to be able to ease into this transition. Also, that way you're not craving these foods. You're getting a little bit of it to kind of satisfy those cravings.
Yeah, everything is in moderation, and it's really important that we kind of establish a good pattern at the beginning so we can incorporate all of these things in the long run. Mm-hmm.
A lot of our patients will start to see results within the first few weeks to about a month, which is really encouraging for them, whether that's feeling less fatigued, they're feeling overall better, they're starting to see the needle move on the scale. But of course, it's also really dependent on your own lifestyle choices at home.
So being consistent at home is also very important. So making sure that you're making the right decisions with your meals, being active, and every single person is very different. So some people might to see a few pounds in the first few weeks, whereas others may take a few months to really start to see the weight kind of come off. Some of the common side effects that we see are nausea, diarrhea, or constipation. These obviously don't happen with everyone and are normally pretty minimal. Normally we see them with starting the medication or with dose escalations, but overall this medication is very well tolerated by a lot of our patients.
And some of the positive side effects that our patients see is they feel fuller faster because of the delayed gastric emptying, so they're not eating as much compared to normal. So your first appointment is actually a 30-minute phone call, kind of health screening with me, the nurse. And during that phone call, we go over your medical history to make sure that there's no big contraindications that would make you not a candidate for this program, like pregnancy, certain type of thyroid cancers, gastroparesis, like we talked about. And then after that, we talk about pricing, what a typical treatment plan looks like. And then if you're interested in going forward, then we talk about our required lab work, again, just to make sure that you're medically safe to start this program, which will then be reviewed by our PA, and then we get you scheduled for your consultation.
Yeah. So once your labs are reviewed by myself or our supervising physician, we will get you scheduled for that consultation. During that, we really do a deep dive into what we offer, what your goals are, and expected outcomes. We also get measurements and photos as well to be able to kind of track and monitor you along the way. After your consultation, we'll set up a few follow-up appointments where we're really monitoring you closely in the weeks to come.
What's really great too is the injections. You can either choose to come in weekly for them if you don't want to take them home and administer them yourself. We're happy to see you on a weekly basis and we'll get to know each other very well. Otherwise, you get to take them home and then we just see you on that monthly basis. So if you're interested in taking the next step, it's that 30-minute phone call screening where we go over your medical history, talk about some goals, and kind of dive deeper into our program. And then we get you set up for a lab draw. And then next we have our PA review the labs.
We normally can get you in pretty quickly within the next few days to a few weeks. And then we will follow closely with you along the way. And we are just here for every single step in your journey.
What's really great about our wellness program is that it is managed by a multidisciplinary team. So you've got me, who's a nurse, you have Kyleigh here, who's a PA, and then it's also managed by our supervising physician, Dr. Horiat here at the Bankston Center. So you have a whole team rooting for you the entire time. And we kind of look at things through different lenses. We want to look at things through a holistic approach, take into consideration your medical history, your lifestyle choices, diet, eating habits, and put that all together to make a program that works well for you. We also are evidence-based. We follow dosing protocols very strictly, again, tailored towards you, but in a way that is scientifically backed, so that way we know will work well for you. Thank you everyone for attending our webinar. We are so happy that you're here with us. Stay tuned for our live Q&A up next, and also be on the lookout for a text message to schedule your consultation.
Hey everyone, thank you so much for joining tonight. My name is Kyleigh. I am a PA with the Bankston Center.
My name is Marissa. I'm a nurse here at the Bankston Center.
We can't wait to start answering your questions. Go ahead and drop any questions that you have in the chat below and we'll get started.
So one question that we have already is, how much weight can I realistically expect to lose with these injections? That's a great question. A lot of people want to know that. So far, clinical studies are showing about 1 to 2 pounds per week on these injections. However, that's very dependent on your lifestyle choices at home. If you're continuing to eat fast food, not prioritize working out or protein in your diet, you're not going to see the needle move on the scale. Whereas if you prioritize good, healthy fats, healthy proteins, minimal to moderate amount of exercise. You don't need to go crazy and join a CrossFit gym right away and work out for multiple hours a day. But if you're prioritizing that, you're going to see the weight come off faster. But really, we want to focus on slow and steady weight loss rather than really fast and drastic, where that can be unhealthy.
And everyone is different. So some people will start to see the weight fall off in the first month, and others it will take a few months to kind of get their body going and with the medication. So just because you're not seeing the weight come off in the first month doesn't mean that the medication isn't going to work for you. So the next question that we have is, can a person be allergic to this medication? Of course, everyone runs the risk of potentially having an allergic reaction to medications, although that risk is very, very low. We keep you at the office for 10, 15 minutes just to make sure you're tolerating the medication well before you go home. And then we follow up closely with you afterwards. So we're always available by phone call just to kind of check in with you.
And we do also start at the lowest dose possible for every patient across the board, just to make sure your body's reacting well to it. How often will I need to take these injections for the best results? We follow standard dosing protocol. And what that means is that we start all of our patients at the lowest dose, 2.5 milligrams, and then it's depending on how their body's reacting to it is how quickly we titrate. We might stay the same for the following 4 weeks. We might bump up, maybe even bump down. That's a conversation with you as the patient, Kyleigh, our PA. But they are once a week injections, and we try to pick the same day every week, usually about in the morning, to inject them. So that way we stay consistent, even if it means setting an alarm on your phone as a reminder.
Next question that we have is, will I regain the weight if I stop taking the injections? Now, this is always a big topic of discussion for a lot of people, and you see it all the time in the media. I think one of the most important factors to adding this medication into your regimen is making sure that we're creating healthy lifestyle changes that can be prolonged for the long term. Now, oftentimes, if someone struggles with weight, it's not an overnight thing. It's a year-long process or years. And so sometimes that can mean that you might be on this medication for a few months, maybe a year, just depending on what your goals are. So we treat this as a way to create good lifestyle modifications. So choosing a healthy diet, really making sure we're prioritizing protein, making a good exercise regimen to really build that foundation so that we can create these lasting long-term weight loss goals with you.
Our next question, what are potential side effects? So any medication, you run the risk of side effects, but again, we start you at the lowest dose. So commonly we find maybe a little bit of nausea. It's been described as almost like a morning sickness feel, where it's just very underlying, but you can still get through your day. A little bit of maybe diarrhea and or constipation. It's just kind of dependent on you, but we really encourage you to stay hydrated. But really the side effects are pretty tolerable. Some patients feel boosts of energy. Some patients feel fatigued. So it's really just dependent, but again, very tolerable. And of course, if you're feeling extra nauseous, we can help you with that, either decreasing your dose or maybe helping you with some Zofran. But again, pretty well tolerated.
I would say also the side effects are most commonly seen when starting the medication, and then also at dose escalations, depending on if we're going to go up or not during the month. Majority of the time, it's for a few hours, maybe a day or two, but most of the time they resolve on their own. We haven't had any long-term side effects that have really caused discontinuation in our patients.
Yeah, nothing that you need to stay home for or anything. You can still go to work, go about your day.
Yep. The next question that we have is, how long does it take to start seeing results after beginning the injections? I think we kind of hit on this in the beginning, but just kind of wanted to reiterate, every single person is so different. So what works for someone will not always work for the next person. We do start low and go slow. Our priority is slow and steady weight loss. So some people will see the pounds drop in the first few weeks, whereas other people take a month or two to really start seeing the weight come off. And that's the same thing kind of when we're titrating down. So you might not always lose the same amount of weight from month to month. It might slowly start to decrease just because we're getting a little bit closer to our goal and less room for it to move on the scale.
Our next question, what are the medications? So these are compounded GLP-1s that you might hear about in the news and on social media, and we compound it so it can be more accessible for you. But they're still the same active ingredients, so they still work just as well.
Yep. So the medication is compounded tirzepatide mixed with niacinamide. Niacinamide has a lot of good anti-inflammatory properties, antioxidants. It's very common in compounded medications. Tirzepatide is that GLP-1, so that is a very big topic of discussion, but it also has the GIP portion. So it's hitting two different receptors in the body, which makes it a dual agonist. And it is working very, very well in our patients.
It not only, slows down your gut motility and your metabolism, but then it's also working in your brain as well to help cut out the food noise or the cravings, as we call it. So not only do you not feel hungry, you're also not thinking about that hunger as well.
Yep. So you're eating smaller portion sizes, maybe less frequently, but really still prioritizing that protein intake. And that's also can be where some of the side effects come in when we're delaying that gastric emptying. Some people can feel a little bit of that constipation, again, normally resolved on its own or by increasing the fluid intake as well. I think the next question is if their goal would be to lose about 10 pounds, is this the right program? It all depends on the patient. So we do have quite a few patients who are just losing or looking to lose that extra 10 pounds, and they are doing very, very well on our program. Everyone is very different, but it is a very good program just to lose those 10 extra pounds, maybe for a wedding coming up or an event, and to keep those 10 pounds off.
And that's, I think, where the consultation and the pre-screen phone call really comes into play. So we can talk about where you're starting for your current weight, what your goal weight is to make sure that this would be an appropriate treatment for you. And if you're one of those that are just looking to lose about 10 to 15 pounds, again, we're not going to crank up the dosing. We're going to probably keep it more minimal, but so that you still get the benefits and you still get the good side effects without massive quick weight loss.
Absolutely.
What type of proteins do you recommend if I don't eat meat? That's a great question. I would encourage the proteins that you're already consuming, but focusing on those more so. We also have some products here in office called Celebrate. We really like them. They're really great tasting. They use whey protein, but they do also offer pea protein on their website too. Instead of like those really sludgy, thick protein shakes that you have to drink as soon as it comes out of the fridge. Otherwise, it gets really nasty. They're ready to drink. Strawberry lemonade flavor, mixed berry, hint of lemon. They're really refreshing. A 12-ounce bottle has 20 grams of protein. We have like little mini drinks that have 15 grams of protein that are a 3-ounce drink, as well as some really tasty protein bars.
The next question that we have is regarding insurance coverage and pricing. And insurance has been also up in the media lately about coverage and not being covered. And that kind of what helps make our office unique. We are able to offer this medication without having those limitations. So every person, again, is so different. So pricing is also different depending on the journey and the program that you choose.
And we are running some really great promos right now. So for the month of March, you can get your consultation for free, as well as $100 off towards your first month. And then as attendees, that deal continues into the month of April. And then as for the price, it's really going to be dependent on your needs and what program you're on, which is what we would talk about in a consultation together. Would I be a candidate if I only need to drop 15 to 20 pounds? Yeah, absolutely. Again, kind of same as that 10 to 15 pound range. We're not based off of BMI, which is what a lot of insurances are based off of for these medications. We're kind of looking at your whole health holistically, big picture. So absolutely. Can I do the program diet only without the medication? We have some great referrals for exercise programs, some local gyms and nutritionists. So if that's something that you're interested in, we can definitely help you out with that, because we understand that medications aren't for everyone, but then you also know what options you have here too. And let's see.
I'm going to say any other questions that you guys have. Okay, the next question is, would I need to come in more than 1 time weekly? So that is a good point. So when we first get started, so at the consultation, we will follow up with you quite frequently. We have a few different phone calls, just again, checking in to see how it's going. Some people like to come in for the week. So it is a weekly injection, and some people want to come in weekly for those injections. They don't want to take the supplies home. They don't feel comfortable, and that's totally okay. We get to know you pretty well.
Yep.
Other people, once they kind of get through those phone call conversations, then we just set up monthly appointments with myself. And during those monthly appointments, we track your measurements. We talk about the medication, see how you're doing on the dose. Is it working for you? Do we need to go up, go down, or kind of stay the same? So monthly appointments after that. Of course, we are always available by email or by phone at any point during the journey, but that is just kind of what most of our patients kind of follow.
Mm-hmm. And for consultations too, if that needs to be virtual because of distance or a long commute, we can definitely make that work too. And as a reminder, you'll be receiving a text message. So please reply with the code word SLIM, SLIM, to be contacted for a consultation. And as long as there are no other questions, we just want to thank everyone for spending their evening with us, getting to know a little bit more about our program. I know we're really excited about it. We've seen some really great results, and our patients are they're so excited to see this weight finally come off, and especially right before the summer too. It's a great time to get started. Again, just want to remind you about our current March promos with a free consultation with Kyleigh, as well as $100 off your first month. Also, for those who are on these medications for 6 consecutive months, we do have a complimentary consultation with one of our surgeons, in addition to a free syringe of Juvederm filler for you. So again, thank you for spending time with us, and we hope to see you in office soon.
Have a great night.
Thanks.